second delay. Can't tell if I'm live yet. There's the little red thing.
I've never gone on Facebook Live, so I have no idea how to do it.
All right, so we're live, everybody. Hi, Jeanne Casteen here, your Democratic candidate for Maricopa County School Superintendent. And today I am joined by Dr. Dionne Wells. Mills, I'm sorry. I don't know why I said Wells. Mills, thank you. By Dionne Mills. And as you can see in the description, Dionne is a OB-GYN hospitalist here in the Valley. And I actually first met her on a Zoom call that Dr. Susan Hughes, I believe, had organized through a Facebook group that I belong to. And I was really impressed by what she said. And then Dr. Mills reached out to a couple of other board members, Lindsay Love and Chandler and Devin Del Palacio on the West Side. And so they decided to come forward. They put together a letter from school board members and partnered with doctors who signed on with that letter as well. And so Dr. Mills gave a speech at the Capitol last Monday. And it's just so, it was heart-wrenching, the speech that you gave. And it's such important work that you're doing. And the words that you were saying on Monday coming from a healthcare professional, they're life or death. So thank you so much, Dr. Mills, for being here today. I really appreciate the fact that you took time out of your busy schedule to come and talk to us. So go ahead, introduce yourself. Give us some background of who you are.
Well, I am, as I said, I'm a board certified obstetrician gynecologist. I'm an immigrant. I am the oldest of 5 kids who moved from Trinidad to Arizona when I was about 10. My parents gave up a lot. My mom gave up her dental career that she worked very hard to establish, and my father was working for the embassy, and they saw that they had high hopes for their 5 kids and moved us to the United States. And I, just being a physician, it's a long, haul. So I did undergrad at University of Arizona, where I got a bachelor's degree of a BS and a BA, so BS in physiology and a Bachelor of Arts in Spanish, and worked hard and did summer school every year. Only time I would take off was winter break, so I got both 4-year degrees in 4 years. I think I did December graduation instead of the May graduation. That was about it. And I always knew I wanted to be a physician. I told my parents when I was 3 that I was going to be a doctor. I don't know what possessed me. I'm a Christian, so I believe that, God whispered in my ear way back then, and he always gave me what I needed to get there, above all odds. So I was always thinking of that when I was in high school and everything else. And after college, I went to Ross University. So I went to medical school, graduated with honors, and then decided to do obstetrics and gynecology. And I decided on that because a couple of things. I feel like I was always a women's health advocate throughout my life. Even in college, I worked for a battered women's shelter where I was the job readiness specialist and a transitional housing manager for them, and was able to see the effects of domestic violence on women and children. So I was always pushing for women's rights and education that women can have about their own bodies so that they're able to better advocate for themselves. And then when I was in, I think the end of college, I did a summer program at Columbia University where we got to kind of see different specialties. And I remember shadowing an OB-GYN, and in the same day, we were running from the delivery room to delivery to a C-section, the OR to another OR, like the regular OR where we were taking, masses out of people's pelvis, to the office. And I was like, you get to do so many different things in literally one day. Because I always wanted to be a surgeon as well. So I was able to find a field that gave me the opportunity to be a women's health advocate and a surgeon, a specialist, and somewhat of a generalist all at the same time. And I feel like it's prepared me for a lot of the things that I do now. During residency, I had 2 kids. I had one child as an intern, and another as a 3rd year. I was just about to start 4th year of residency. And because I always believed in accomplishing as many of my goals as I can at all at the same time. I didn't want to be I guess, save something and then do it then and do it then. If I was able to accomplish it simultaneously, then sign me up, which made me look really crazy to a lot of people. But you know, it really didn't stop me because I was just determined. I just knew that that's what I needed to do. I mean, I, you know, got intern of the year award while holding a 4-month-old, you know, so there's no reason to not be able to excel if you don't, if you're not willing to put the work in, basically. But that's also because I had good support. You know, I'll give a shout out to my mom and my amazing husband, who my mom came to be with us in residency so that I could, you know, we could both work and we can still have 2 kids in residency. So she was a big player in that. So I got to make sure to give credit where credit's due. And then I graduated from residency, which is another 4 years. So at this point, you have 4.5 years of college, 4 years of medical school, 4 years of residency, and then you finally get to you know, practice medicine by yourself. So in 2013, I moved back to Arizona because I did residency in Philadelphia, and you know, moved back to Arizona with my 2 kids, and at the time, and my husband and my mom. And one thing that I did before I went to medical school, which I did when I was at the end of college, was I also participated initially as a translator, because one of my degrees was Spanish, but as a translator on medical missions to Mexico. And I went as a translator there and to Honduras. And then I couldn't do it for 4 years because residency eats up your life and you can't go anywhere. And the missions were always during July, and June and July and August are no vacation times for residents. But I did promise them I would come back and be a physician this time instead of a translator. And so in 2013, right after residency, we came back to Arizona in, I think, July, and like the very next week, I went down to Mexico for a week without the family. I was still very exhausted, which I don't know why I did it, but I just wanted to do it. So I went down as an OB-GYN instead of a translator. Actually last year I was able to take my, well, he's going to be 11 in November, so he was almost 10 then. Took my almost 10-year-old to Mexico with me for a mission, and I've been teaching him Spanish. So I made him put his Spanish to good use down there, and it was really good to see him after, you know, and a lot of these doctors have seen me from when I was like little. I was in college, and they've seen me grow up, and to then see me come down with my own child was really, I think, really cool, including the people that we know in Mexico. So we partner with pastors and physicians and dentists down there, and they knew me from when I was younger, and they've seen me kind of grow up. And so it was just a really good thing to do that. And my son was supposed to go with me again this year, but of course, because of COVID, we had to cancel. And that mission has been going for about 23, 24 years now. And we never quit. They never cancel. And they had to cancel this time because of COVID. But yeah, so for 7 years, I did private practice as a general OB-GYN, and started feeling like my life was getting a little monopolized by my job. At this point, I have 3 kids, because I had the 3rd in 2015. And my, you know, amazing husband became a stay-at-home dad, and I was a primary breadwinner, and I was always at work, or if I was home, I was charting and answering, you know, reading lab results. And I had also started to be very much more involved in advocacy work, because I'd always been that way. But when you're in medical school and residency, you're in a black abyss, and you just are trying to stay alive. So you don't kind of pay attention to as many things as you usually would. And then I felt like coming out of residency and just being in the world again, I was like, oh gosh, it really stinks out here, you know? And so I started kind of speaking up about different things. And for the last couple years, I've been working with some school board members and teachers on the Equity Advisory Board for Chandler Unified School District. And that has been eye-opening for me. I remember when I was in junior high, and I think I still have the newspaper clipping of when a reporter came to the school and asked us about how we felt about how history is being portrayed in the schools. And I remember speaking up very adamantly. I came from Trinidad, where it's such a diverse population: Indian, Persian, Black, white, Chinese. I mean, literally every race is represented in Trinidad. And there is racism there, there's racism everywhere, but America has its own breed and own special species of racism. And I remember having to learn about slavery and everything in schools where I was always the only Black person, because I was always in, unfortunately, that correlated to always being the only Black person because I was in all the advanced classes in high school. And having, you know, when they go over the slavery section, you know, the teacher having to look at you like, sorry. And reading the books and going, well, you know, the settlers were forced to retaliate against the Native Americans because da-da-da. And I knew better even back then that the verbiage was ridiculous. Like, are you kidding me? That they were forced? Somebody took their hand and made them come and kill all these people? Like, this is how the books are made? And it was very traumatic for me. I was very homesick. And then to also have to learn about the truths of this country, it was just very hard. I remember being home, reading all the textbooks and like being very upset and sometimes crying while I was doing my homework. And, you know, my teachers didn't know about that. They didn't probably even care about that, because what do they know? They just know that, you know, they don't understand how traumatic that is, especially when they obviously had a very limited vocabulary and limited way of dealing with being equitable in school. So it wasn't a surprise to me then, having 3 kids in school, that I was like, no. We're gonna just do our own education of you when it comes to you know, history and stuff like that. And so I started you know, making sure that I asked for my kids' history books so I could look at them myself and see if there's anything ridiculous in them before, you know, having them, you know, do the school year or whatever. So it was really good for me to get to be on the advisory board, because I was able to really get an inside view of what was going on in the schools and what efforts were being made. And I strove to hold the district accountable for the promises that they made. But it was also disgusting to see how many parents adamantly were against equity and still are. So that kind of consumed me for the last couple years. And so I started realizing that I needed to separate things a little bit and not be working so much, so that I could actually do some of the things that I was really passionate about. Because I also had started going once a month to talk to girls at a group home at Florence Crittenton about, you know, sex health and just female health, right? So educating women so that they can better be able to advocate for themselves. And so I wanted more time, because I was always doing that when I was post 72 hours of call and exhausted. And I was like, no, I need more time to do the things that I'm passionate about, not just medicine. So recently this year, I decided to be an OB-GYN hospitalist, which is a little bit different. I feel like it's, to me, it's like the best parts of being a physician without some of the minutia of office work. I get to deal with traumas and, you know, emergencies in women. I get to still go to the OR if there's a surgical emergency, but I get to just do it at 24 hours at a time. And then I get to be off for a few days, and then I don't have to be answering my phone after I leave work. So it's been good. It's been an adjustment, but I really like it. So that's where I am now. And then of course we met because I got involved with really with COVID coming up and rearing its ugly head this year. Watching, like I said in the press conference, you know, watching like a slow train wreck. because the last few years I've seen that this anti-science, anti-intellectualism mindset that this country is in, because of its own fault, not just the leaders. I mean, our leaders wouldn't be able to monopolize on that if it weren't for people who share the same views. But and I knew it was going to end very badly when it came to something that had to have the nation coalesce around science. The worst time to need a nation to coalesce around science is when a nation doesn't believe in science. So it's not a surprise to me and a lot of my colleagues as to why we're here, but that doesn't make it any easier. So yeah, we've been doing a lot of work with just trying to get our leaders to follow the science and advise our schools so that they can safely reopen and so that they can kind of drown out some of the people who are speaking to them out of sheer selfishness, and really put the science at the top of the list as far as who to listen to when it comes to decision making.
Sure. Wow. I mean, that's a pretty incredible resume. I like how you said I wanted to just accomplish all the goals at once. And it's like, yeah, I'm just gonna go ahead and get 2 bachelor's degrees. I'm gonna have kids while I'm going through my residency, and I'm just gonna do it all. And I tell my kids all the time, the more you do, the more you can do. And I think you really encapsulate that mentality. I think that's amazing. Your parents must be incredibly proud, that's for sure.
They are, and we have, there's 5 of us, and we've all done amazing things. I'm number 1, and then my sister is a vice principal at a school, and my brother is an opera singer, and he also does other work with job recruitment and stuff like that. And then my other sister, number 4, is a vascular surgeon, and then my little sister, she is kind of finishing up PA school, trying to figure out what she wants to do between that and dentistry and other things. So we don't, listen, immigrants do not waste our parents' sacrifices when we come to this country, okay? We just don't.
Mm-hmm.
We just don't.
Yeah, I hate the way that, I've been in Arizona now for almost 30 years. And, I was here when Sheriff Joe got elected. Basically, that was pretty much the year that he got elected. And he just got progressively more evil and horrible. And, I remember being a school teacher where he would park his Maricopa County Sheriff's Office buses across the street to intimidate my students, and on those days, we might have half as many students. And, SB 1070 happened, and I saw a bunch of my kids, they left the state or maybe even left the country. And just like you said, well, and it's the quote in Hamilton too, the
immigrants get the job done. Yeah.
Right. And it's just all about fear of the unknown. And again, no science, anti-intellectualism, these all go along together. So I'm curious right now, maybe tell us like a little bit, what did a typical day in the hospital look like before, say, February of this year? And what does it look like now? Because a lot of people just don't think that this thing is real. It's a Democratic hoax, 5G, Bill Gates.
Well, ironically, at the same time that COVID was coming up is when I was making my job change. And so in January and February, I was, interviewing for positions and working in the office as well as in the hospital, and just seeing the normal stuff, which is still a lot of work, but it was, you get to have 10 people in your labor room, right? When you're having a baby. And, I was always one of those people though, who would wear like a face mask with a shield and my head covered and boots up to my knees and like a gown, because if you can only imagine, things kind of splash at you when babies are coming out. So I didn't have to add too many things onto what I was already wearing. But, you didn't have as much paranoia as, can I touch that patient? Can I hold that patient? I mean, we do a lot of touching and holding and comforting and, hugging and high-fiving and congratulating, not just labor nurses, but physicians too, OB-GYNs. And so you didn't think about that. You took somebody to the main OR because they had a ruptured, ovarian cyst or something, or ruptured ectopic pregnancy or something like that, and you wore your mask and everything, but you weren't like deathly afraid that you're gonna like die because you went in the OR with them. And then I felt like in a way I went, because in private practice we were seeing patients at hospitals that weren't as high level as far as trauma and NICU, so we were kind of sheltered a little bit. Like we had, as the COVID started picking up, we had maybe like a couple COVID patients, and we were trying our best to be careful. We were also dealing, by the way, obstetrics and gynecology. We were dealing with being told by medical leaders and professionals that we were not frontline and that we didn't need to be provided as much PPE as other specialties. But that's also, once again, as we will talk about, it will come up numerous times, COVID highlights crap that's already going on that should be fixed, right? So women's health is often undervalued, under reimbursed. So you can actually, I do a lot of procedures that overlap with, say, a urologist. But if I look in the bladder of a woman, and the urologist looks in the bladder of a man, they could probably get paid more for that procedure. If I do certain surgery on a woman, I may get reimbursed less than if a similar surgery was done on a man. So this has been an issue. So we were told, oh, you guys aren't, you're not frontline. They forget that we do real surgery too. And so they were like, nah, you don't need your N95s unless, you know for sure the person has COVID. And remember, did we ever know that anybody had COVID? Because Arizona was not testing anybody.
Right.
And me being the person I am was like, I dare you to tell me not to wear a mask, because I'm wearing my masks, even if I have to buy them myself, because before COVID, people would come into the office coughing on you all the time because they didn't really care about the fact that you have kids at home that could get sick because they brought their sickness to you for, visits that were often elective and could have waited till they felt better. So after COVID, they certainly weren't gonna just, all of a sudden respect your health and safety and try to protect you. And then of course, nobody was doing mask mandates. And from very early, I remember telling people in my practice, like, trying to get my medical assistants and my colleagues, you've got to wear masks with every person. And it's funny because I was gone for like 3 weeks because I was really sick. I thought I had COVID. They tested me 2 or 3 times and it was always, 2 times and it was negative. But I was on my bed for 3 weeks. I quarantined from my family for at least 2 weeks because I just didn't know. And during that time, the hospitals kind of came around, and the American College of Obstetrics and Gynecology came around, and the CDC came around, and they were like, oh yeah, I guess, when somebody's pushing, they're spitting at you, and that probably will cause things. Or, oh, I guess, yes, when you're doing surgery on somebody and you're intubating them, that's going to cause problems. So yes, we should make sure that our OB-GYNs have what they need. So luckily, when I came back to the hospital in private practice, they had finally been giving us N95s. But before that, preparing to go back to work, I was spending hundreds of dollars buying my own masks and stuff as anywhere I could find them, because there was no way I was gonna, I had a mindset in my head of, if when the PPE runs out, so am I, because I can only take care of 1 patient if I die. I could take care of 30 patients if I stay alive. So it's just common sense. And then I became a hospitalist at a higher level hospital where it's a trauma center, and we take babies from all gestational ages. Some hospitals only take babies 32 weeks and up. We take babies, everything. So I felt like I was going from the frying pan into the fire, but in a good way, because everybody at our facility at that point, by the time I started at the end of May, early June, were on board with wearing masks. And our facility was really good at making sure that everybody did that. And so I came in with my, KN95s, and I had my N95 that I needed, that they provided. And yes, I wish we didn't have to wear our masks so many times before we switch them out, but at least we have them and we can go and get a new one if we needed to and stuff like that. So I almost felt more safe because I was at a facility that got it and was already equipped to do what was necessary. And then we started just seeing tons of COVID patients. I mean, as I said in the press conference, there were times when I remember one 24-hour shift where I had multiple transfers from other hospitals, and it was all because of women, pregnant, um, respiratory failure. We had admissions to the medical floor. We had admissions to the ICU. One of our patients had to be intubated. I mean, it was really bad. And we kind of all told each other, our group of hospitalists, well, we're just going to have to get used to just running a COVID unit now, because it felt like we were seeing more COVID patients than anything else. And it was kind of scary because, nobody is an expert on COVID. I will say this so many times. As much as I speak up and speak out, it's not because I'm coming here as some expert on COVID. Nobody is. My intensive care, internal medicine doctors are amazing. The pulmonologists that I work alongside are amazing. Our infectious disease doctors are amazing. And we're all trying to figure this out as we go along. And we're all using data from places that have gone through it before us, that have realized what works and what doesn't work. Looking at studies that are scientists' friends. I mean, without scientists who are doing the bench work of research, we could not do what we do. And I have a friend who's a scientist, and I always tell her every once in a while, like, I couldn't do what I do if you didn't do what you did. And they don't get paid enough, by the way. But without our scientist friends, we were just trying to make sure that we had the information that we needed so that we could best take care of our patients. And so it's been scary because you feel like, it stretched me a little bit as a physician, but I think in a good way, because this is what we signed up to do, was to be inquisitive and learn about new things, and try to admit when we don't know the answer to something, but make sure that we're doing the best practice that we can with the thought of do no harm in it. As an OB-GYN, it's a special kind of a thing because I have to cater for two patients. And so sometimes when we are managing the patients with the pulmonologist or with the infectious disease doctor, I'm often having to say, just tell me what the patient needs, because sometimes they'll be afraid of saying, hey, I need her to have this medication, because they're afraid of what it would do to the pregnancy. And I'm like, I cannot tell you if it's safe or not if you don't tell me what you want to give her. Tell me what you want to give her, and I'll let you know if we can do it. Because it is scary to know that you have two patients at possible risk when you make a decision for one. But I mean, it's been good. It's been a learning experience, and I've been honored to care for these patients. But it has been a little frustrating because a lot of the patients that come in didn't really have to ever be sick in the first place, and that's where it's frustrating. Doctors in general are all about preventative care, because preventative care saves lives and it saves resources, money, everything like that. And we're not really practicing full preventative care right now when we don't do the simple things that we know we can do to keep people safe.
So why did you decide to connect specifically with the school board members? I mean, what do you see happening if we go ahead and open our schools August 17th, which is the most current recommendation coming from the governor, who's not a doctor?
Everything's been pretty organic. Like, somebody, and that somebody knows somebody else, and they start saying, hey, I really want you to talk to this person. I want to connect you with that person. So it's really been, I've gotten in touch with certain physicians through my equity work, and then they have also, because remember, this coronavirus management is an exercise in equity. This is an opportunity for our schools and our nation to put their money where their mouth is when it comes to equity. Everything that we are doing is about making sure that we protect those who don't have a voice, protect those who may not have an ability to speak up for themselves and to protect themselves. And so the whole decision making behind the schools came about with just looking at the science. And I will admit that it was a bit challenging for me, because every time I say we shouldn't go back to school, I just want people to know that it's not with this cavalier, oh, who cares about the kids who have IEPs and special needs and who it's hard for them to do remote learning? Who cares about the kids who don't have internet or technology in their homes? Who cares about that? It is with those kids in mind that me and my colleagues still say that it's important to stay home, and for a couple of reasons. In Arizona, and I think in Chandler and Scottsdale and Phoenix, there are a lot of parents who have the ability to work from home, who have the ability to have internet and technology in their homes. And if more parents can do virtual learning, then we have less congestion in the schools for the kids who don't have that option. So that instead of 20, 30 kids in a room, there might be 10, 15 kids in a room. And now those kids are also safer. What is the point of exposing those kids whose parents, if they were to get sick, those parents are essential workers. They're in positions where they cannot take 2 weeks off of work because you have to be quarantined for at least 2 weeks. You may be sick for weeks. We have people who have we have rehab centers that have opened up just for COVID patients, because it's not just about getting better and you don't die. It's not just about not dying. There's a lot of long-lasting pulmonary and multi-organ effects from COVID that we are seeing in a lot of people. So if you have somebody who's working at a grocery store, who's working at a nursing home, who didn't have the luxury of doing their job from home, they are even more the people who can't afford for their kids to either get sick or to bring the illness home to them. So we're protecting those kids more by the people who can stay away from school, stay away from school. And honestly, a lot of the people who are pushing for, not all of them, and we have a lot of people who truly are in a rock and a hard place as to why they chose to say that they want their kids to go back to school, in August. It's not like evil people, all around, but there's a lot of parents who have the ability to stay home with their kids. And if more of them did that, then we would be able to protect those special needs kids and kids who need in-person interaction, because the schools are now going to be not as full, and we could really properly socially distance them and accommodate them. So it's really about, it's just another aspect of equity in education, which I've been working on for a couple of years. It literally is equity in education. And so I think that kind of, my interaction with those circles kind of led me to bump into school board members who told me about other things. And it's kind of just been like a whirlwind of connecting with people who are also trying to advocate for that. I don't know if I answered your question, but.
No, you did. You totally did. So yeah, no, I was just talking about this with, I think it was Devin. Devin was on last Friday. And, in some school districts, the parents are really angry and really want the kids to go back to school because it's hard for them to work from home. But then over here, I was talking to a board president, and she said, our families who are the frontline workers, who are, working at Fry's or in service industry, they want it more out of necessity. So exactly what you said. And I just wish that we had the kind of leadership where there were like empathy leadership. That's what we need right now. We need some empathy in this country. And I've seen it kind of deteriorating over the last several years, but I think especially since November of 2016, that's when we've really seen the downslide of empathy. And so, when friends or acquaintances talk to me, or I'm on social media and somebody's talking about how they're not going to mask up because it's uncomfortable for them, I just try to say, it's not about you, first of all, and that's okay that it's not about you, because I have enough friends who work in the healthcare field who have families that they have to provide for and go home to, and we're overwhelming them right now because too many people lack empathy and compassion. So you go ahead and deny the science if that's what you need to do, but maybe just embrace empathy. Deny science all you want, but at least try to be a kind person who's actually thinking about what other people have to go through every day. Because the stories that I've heard from you and other folks in the healthcare field is that it's an incredibly stressful environment right now. And people are making really difficult, terrible choices about who will get the respirators and things like that. From all I heard, we're looking at a shortage of ventilators and respirators. What are the hospital's capacities? Do you know by any chance? I know I didn't prepare you for that question, but.
One thing that we're struggling with is getting transparency in data reporting. I get emails from my hospital every couple of days, sometimes once a day, on our inpatient situation, how many people we have, how many people we have on vents, how many people we have on vents that have COVID, yada, yada. And we definitely have been in surge capacity. Whole floors have been taken over for COVID. We have a small little unit actually of just COVID pregnant patients. And so, but then, we have some people saying, well, my facility, we barely have anybody. And so therefore, that's why we should relax. In my facility, no, we're overwhelmed. Well, I can definitely relate with the public having a hard time to process everything and to know who to trust. But at the same time, it's just not the time to rest on our laurels. Either way, the consensus is that we are not where we need to be. And speaking of things being uncomfortable, and maybe for me, I have a hard time personally having much sympathy for people who are not willing to do things that are uncomfortable, because even though they know it will be for the betterment of themselves or for others. I'm a Black female physician in America. My life is uncomfortable on many levels every single day. If it's not for one reason, it's because I'm sitting next to somebody in the doctor's lounge who's talking about how they don't see color, or somebody saying something ignorant in the OR, or somebody, if it's not one thing, it's the next. Who doesn't want to take orders from me? Because how dare this Black woman tell her what to do? Well, I'm the surgeon, so too bad. Who wants to do this? Who wants to do that? I have been wearing two masks, a KN95 and a surgical mask on every day when I go to work, and I literally will wear it for hours at a time, sometimes 8 hours. The only time I take it off is if I can run to my call room and take it off and breathe. It's like I could breathe. I only do that when I'm in the call room. Other than that, I have two masks on. So when I take it off, I have creases on my face, I'm doing surgery with the N95, which is even more tight and restrictive, and a surgical mask and a face shield and a gown and everything, and I'm uncomfortable. So if I can do things that are uncomfortable, I don't know if people understand how ridiculous it sounds to say, what if doctors decided to say, well, I'm not going to wear a mask when I do surgery on you because, it's just uncomfortable. They would be wanting us to get sued for malpractice. Well, it's the same thing. So the efficacy of masks is not a new thing. Virology 101 says that when you have an airborne illness, if you cover up your face and nose, it decreases the spread of an airborne illness. And this is where poor leadership comes in, not just locally, but nationally. We had people talking about how, we're not sure if masks are working. And then Dr. Fauci himself had to admit in his last Senate hearing that the reason that they didn't push for masks initially was not because masks don't work, but because we did not have enough supply, because the president had not enacted that Protection Act that would ramp up production. So we didn't have enough supply. And so we couldn't get enough for the healthcare workers, furthermore, the general public. So we didn't want everybody going on Amazon and buying all the masks. So we wanted to kind of tamp it down a little bit so that we wouldn't have a run on masks. Now, that is a crying shame. Now, I feel like messaging would have been better if it said, hey, we know masks work, masks help, but we are really worried that we don't have enough for our providers right now. And that way you don't have to backstep a month later when you go, oh yeah, masks work. Now that we have enough, you can go get masks now, because anybody is going to be like, well, how come masks didn't work a month ago and now all of a sudden it should be mandated? So I don't blame the public 100%, because when we don't give clear messaging, we cause confusion. If we have weak leadership, we cause confusion, and then we're asking people to trust us when we should have been really very clear and straightforward about the things that we knew about in the first place. That being said, I truly believe in a lot of, I speak for thousands of physicians who are in Facebook groups with me. We have COVID physician groups of all kinds right now since COVID. And we truly do feel like when you decide to come to the office visit, to the hospital, and you make a stink and you refuse to wear a mask, you are telling us that you do not value our life. And that's what you're telling the person at the grocery store when you yell at a poor Costco person saying that you refuse to wear a mask. You are telling that person that you do not value their health and safety. So please don't be surprised when they kick you out of the store. I mean, you can't have it two ways. That's literally what you're saying, that just a little thing you could do to help protect me and you're not willing to do because it's too uncomfortable. That says a lot about you. And so, we don't die. There's no CO2 buildup. I've shared enough videos on my Facebook page about that. It's not a thing. How much oxygen is in the air is not the same as how much oxygen is in your body, because that's not how the lungs work. Oxygen saturation is different from surrounding CO2. So you will not die. And if you have medical conditions that make it very hard for you to have your face covered, you're the one who shouldn't be going out anyway, because you're more likely to die from COVID if your lungs are already sensitive enough that you can't wear a mask. So either way, sorry, I just had to get that in because it's a peeve of mine, and I just drives me crazy to hear.
Right ahead. All right. So what you're saying also that like Lysol injections don't work.
Lysol injections don't work. And I will tell you, I personally know pediatricians who the day after that very irresponsible and ignorant speech had phone calls from moms asking them, how much bleach should I put in my child's nebulizer treatment? How much of this I mean, we're not making this stuff up. This isn't like, oh, I heard from heard. We are, every time the president opens his mouth, our job gets harder. As you know, somebody died from, taking hydrochloroquine because people don't, the combination of being very gullible, not educating yourself, being very impressionable, and then not necessarily having high education means that you're not necessarily going to go find a proper hydrochloroquine dose. You're just going to take hydrochloroquine from wherever you can find it and then overdose. And when the president's words mean more than Dr. Fauci's words, even though the president admittedly is not a doctor, that's a problem. So, Governor Ducey and Dr. Kara Chris they're not advocating for the science. And that's all I have to tell people is if you're always going to find a couple of doctors or a couple of physician assistants or nurse practitioners or nurses who will say, oh, this is all, dumb. I feel fine with kids going back to school, yada, yada. But all I ask is that if it's hard for you to know who to listen to, don't treat it like a popularity contest. Just look at the science. Like, we have the guidelines from the CDC. We have the guidelines from the World Health Organization. We have multiple stories and proof of countries that did it according to those guidelines and succeeded, and those who didn't and failed. You have the information you need in front of you. So if you have somebody, if I come on and I say something that goes against those guidelines, then don't listen to me either. It is actually a little easier to sift out who to listen to than not, as long as you're educating yourself.
Yeah, I feel like I could probably talk to you about this all day, and I think I would probably just end up feeling frustrated because the science deniers are going to be there no matter what. And I'm grateful to you and people like you who, not only have devoted your life to helping others, and not just helping others, but even going further than that and helping folks who are in our most vulnerable communities. So that I really appreciate that from you. And again, everything that you say, I wish you were in Kara Chris' position, because I think that, I want somebody who's actually going to tell us what we need to do and not what we want to do or what the Republican Party wants people to do so that people can get reelected. It shouldn't be.
I mean, this is life and death, and their decisions make a difference on life and death. And I really wish that they would you couldn't possibly do the things you do if you really understood that. So I'm not sure if they really understand that lives are affected by their indecisiveness and hypocrisy. I mean, really, why would Governor Ducey, after he refused, when we got over 3,000 physicians and providers to sign that mask mandate letter, all he did was then say, okay, the mayors and the cities can decide what they want to do. He never put the responsibility on himself. All he did was kick it down to the next people. So then now in Arizona, we have spotty mask mandates. So by doing that, he's not keeping people safe. And and then he went on and went to the rally, Trump rally with hundreds and thousands of people with no masks on. That's poor leadership. I mean, if I said smoking kills you and I'm smoking a cigarette,
Right.
I will and should lose all credibility as a physician. Mind you, there are lots of physicians who are addicted to smoking because we are human beings. But at the same time, they know better than to be smoking in public because they know how hypocritical it looks while they're also working hard to quit. So for Governor Ducey to now, and especially in the last press conference, to say, it is so great to see everybody wearing masks. Well, no thanks to you, because you refused to mandate the masks. So you made the mayors have to be the bad guys and do what you refused to do. And now you're actually like trying to take credit for the fact that cases might hopefully be going down soon because of the mask mandate. You know, my husband has been saying to me over the last couple of months, he goes, I just see that everything you are pushing for is basically just asking people to do their jobs, like, or helping people do their jobs for them. And I say, well, that's kind of how it feels, you know. You know, we're working right now with trying to get some school recommendations together so that we could give it to the schools so that they can see, okay, what do we do if somebody is sick? How do we know when to quarantine? How do we keep the classes, you know, spaced out properly? But that's something that Kara Christ and Kathy Hoffman honestly should have put together already for the schools. That's not something that I should be doing in my free time that I don't have for free. So right. It dumbfounds me that it's, you know, mediocrity in leadership is killing this country on every level. And I hope that the American public understands that your elections have consequences. Your lives really are affected by who has the power to make policies that affect your life. This is not, and we have to have higher standards for who lead us, and we have to pay better attention to who we elect.
Yep, absolutely. I couldn't agree more. And I know I'm going over time. I love what you said. Mediocrity in leadership is literally killing us right now. And, you know, to go off on that, you know, education shouldn't be partisan, and public health shouldn't be partisan. And it's a real disappointment to see that that's kind of where we are as a country. So I want to try to end on a more upbeat note. And you kind of gave me the perfect say, like, you don't have any spare time. You said, I don't have any free time, but okay. You have a long shift at the hospital, or, you know, you can't watch the news anymore and everything's getting like, what do you do to unwind right now to kind of just help you to stay sane?
My husband's trying to get me to work on that. So, you know, before COVID, I was at least able to go to the movies or, you know, stuff like that. But now we're stuck. But I try to, you know, thankfully I have a pool. So I try to go in the pool, and I listen to music, and I'm kind of a masochist though, because I read a lot of books, and some of the audio books are not light reading. I truly feel like I just always want to stay educated on what's going on. So, you know, I read a lot of books that are probably not the most feel-good books, but the more educated I am about something, it makes me feel better, if that makes sense. Because I don't like speaking out of any kind of ignorance. So if I'm talking about, you know, race relations in America or something like that, I like to be able to know what happened in the summer of 1919 in America. It sounds really weird. But every once in a while, when I feel like it's too heavy, I will indulge in a romance novel. And that usually resets me. And then I'm like, okay, now I can read another, like, you know, heavy book about, you know,
about white supremacy.
Yeah, exactly. That's a lot of stuff that's on my audio books right now, is a lot of white supremacy stuff. And also medicine, a lot of, you know, horrible things that we've done to people in the name of science, which as an OB-GYN, it's my responsibility to know that too, because remember, it's all about equity. We can't ask our patients to trust us when we cannot understand where they're coming from and why they might be cynical when we tell them to do something. And that's also why, you know, so not really that exciting. I do like to spend time with my kids. I have 3 amazing children who love and support me, and their snuggles, I think, recharge me better than anything else. So if I just get some snuggles, and we call them huggles, which is hugs and snuggles together, and lots of kisses, that usually does the trick.
Aw. Well, thank you so much, Dr. Mills, for being on today. I really appreciate you. I personally, I don't know about everybody else there's a whole 5 people watching, although at one point there were like 12. I would really like to see you run for office someday. I think that you would make a great candidate who could really help improve things because you have such a great perspective from so many different angles. So I just want to say thank you for everything that you do. And I'm glad that our paths cross, and I hope that we'll be able to collaborate together more and more.
Yes, thank you for having me. This was fun.
So much. All right, now go relax for a minute.
I will.
All right.
Bye.
See you later.